right now during our COVID crisis, it's important to remember that grief does not always come in the form of a loss of a life. Right now it could be the loss of a job. It could be the loss of freedom for being able to leave your house for several weeks at a time. So it comes in many shapes and sizes. And right now, the ability to grieve and mourn has been impacted as a result of COVID-19. COVID-19 has impacted the traditional way we tend to deal with grief and loss, which is coming together, gathering as a family, gathering as friends to mourn the loss of a life or relationship, whatever that may be. And due to COVID, that has impacted our ability to be physically present with each other. However, doesn't mean we can't be socially connected. One of the other impacts it has had is closure. Being able to say goodbye, to seeing somebody's face before they pass and having that closure to move on is no longer there. But I think we've, as a society, have become a little bit more creative in the last few weeks, utilizing the resources that are available to us to still be able to go through that grief and mourning process while we're unable to be physically present with each other. So whether it's getting on a Zoom call and attending a funeral via Zoom, sitting Shiva, going to a wake, still reaching out to our loved ones and connecting is still extremely important in order to go through the process of grief. We know, according to Kubler and Ross, there are 5 stages of grief. Those 5 stages of grief can look different to everyone. You do not have to experience this 5 stages of grief in any specific order. And everybody's timeline to heal is going to look a little bit different. Some of those contributing factors could be your relationship with the deceased, the cause of death, if you have prior mental health diagnosis or symptoms, and also the level of support that you have. Grieving tends to be transitory, so if you're continuing to experience chronic or debilitating symptoms, it might be time to seek professional guidance by a licensed clinician or a psychologist. And that could mean there might be more complicated grief that you are experiencing. So believe it or not, many of the tools that would be recommended to utilize in order to cope with grief and loss are still readily available to you regardless of our COVID crisis. So encouraging talk, sharing your experiences, sharing your emotions and feelings with loved ones. And if you're not ready, everybody has their own timeline of grief and what that looks like to them. And if you're not ready right now to share that and communicate that to others, there's also journaling. It's releasing those emotions that you're experiencing so that they don't build up. It's cathartic. So we look at our body and our brain as a garbage can. So what happens when you continue to bring in, take on different things that are happening in your life? So a loss happens, you stuff it down. I don't want to experience that sadness. I don't want to experience that anger. So I push it down, and then something else happens, a COVID crisis, and we have a loss of our ability to be out there in the community with our friends and family physically. So we push that down. I don't want to experience it because it makes me vulnerable to experience emotion and pain. So our bodies are like garbage cans. We continue to stuff, and eventually what happens, you can no longer, that last piece of paper that you go to throw in, you explode, and maybe you have heightened anger, anxiety. So the last thing we want to see you do is push those emotions down. And like I said, while you might not be ready to communicate that to your friends, you might be able to feel more comfortable journaling, and it's just cathartic to be able to get those experiences and those feelings off of your chest so they don't build up, so you don't explode. So I'd highly recommend, either if you're not at the point where you can talk about it, you can journal. Getting out and being physical. So whether it's downloading an app or something on TV to be physically active, going out for a walk, while of course making sure that you're physically distant. Eating healthy. A lot of times we tend to find comfort and solace in food, but we also know that that can be detrimental to the healing process depending on what we're consuming. Bibliotherapy. There are amazing books out there right now that can help the grief process. Support groups. And while you can't attend physically a support group, there are access online to different support groups depending on what type of loss or grief it is. Creating rituals in memory of the loved one, or in memory of the loved one. So whether it's cooking their favorite meal during a holiday dinner, creating a day of the week where you're going to spend time to memorialize them, making collages, setting balloons off with memories of them. A lot of this is to heal and to, in turn, be accepting of the process.